Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on precautions you have to take. First one is exercise. You have to remember that the exercises are done to strengthen your muscle, not to relieve your pain. By strengthening your muscle, you can relieve the pain. It is not that exercises will relieve the pain. What exercise does is it will strengthen the muscle and give stability to your joints. This will reduce the pain. You have to do the exercises only when you are pain free. If you have any kind of pain, you have to avoid the exercises. It is not that you have to strengthen only your back. Entire core has to be strengthened. Your abdominal muscle has to be strengthened. The muscles on your sides of the abdomen has to be strengthened along with the muscles of the back. Entire core have to be strengthened so that there will be stability to your lumbar spine. Mostly you have to do either flexion exercises, extension exercises. You have to avoid rotating exercises, and you have to avoid mostly lateral flexion exercises as well. Mostly you have to do flexion exercises where you can bend forward, and extension exercises where you can bend backward, lateral flexion exercises where you can bend left side or right side, and try to avoid rotation exercises where you rotate your entire trunk to left or right. These kind of exercises to be avoided. For example, when you bend forward, if your pain is increasing, mostly this type of people has to exercise by bending backwards so that your pain is relieved. When you have pain by bending backward, these kind of people will get relief by bending forward. You have to do more forward bending exercises. If you don't exercise your core, what happens is your muscles will not have work and they become atrophied. Atrophied means they become thin and they become weak and they become useless. In order to activate these muscles, you have to do exercise regularly. If by any chance you have started new pain or the existing pain has increased while doing exercises, you have to stop exercising at that point in time until you recover from the pain. Whenever the pain increases after exercise, it can be due to several things. One is wrong exercise is advised to you. You are doing the exercise in wrong way, or you are doing the exercise in a wrong timing. All this can lead to increased pain. You can use lumbosacral belt where there is a belt kind of a thing you can put around your waist. You have to be very careful with this belt. You have to use this belt only when there is acute pain or when the pain is increased. When there is no pain, you have to avoid this belt as well so that your muscles get strengthened naturally. Coming to the postures, how to sit, how to stand, how to lie are very important for the patients who are suffering with lumbar spondylosis. Do not get up or do not sit suddenly. Do not sit or do not lie on the ground, and also do not sit, do not lie on the sofas or chairs or the cots which are very low to the ground. This can put further pressure on your lower back and this can exaggerate your symptoms. So do not do these kind of things. It is very important how do you get up from the bed. It is very important you have to turn to left side or right side and take the support of opposite hand and slowly you get up from the bed. Same thing with the chair. When you are getting up from the chair, you have to take the support of your hands. You have to push the chair with your hands and get up slowly. Do not sleep on the mattress that are sagging. What I mean by this is do not sleep on the mattress that are made up of spring or water beds. It doesn't mean that you put a bed sheet on the flat cot and sleep on it. There is no need for you to do that. You can have a small non-sagging mattress which is 1 or 2 inch thick and you can comfortably lay or sleep on that. There are certain type of movements you have to avoid. Avoid bending forward, avoid lifting weights, avoid sitting in the Indian toilet position, that is squatting position. These are all not good movements. And also whatever the movements you do, you have to do slowly. You should not be jerking and you should not be doing fast or vigorous movements. Coming to the diet, always take low carbohydrate diet. Carbohydrate is one of the major reasons for inflammation and bone degeneration. Take low carbohydrate diet. Take diet that is rich in vitamins, minerals and fiber. You can take plenty of protein. This can strengthen your muscles. And coming to the prognosis, if you don't take treatment as early as possible, the disease may progress in stage. Initially, the symptoms can be localized. After that, the symptoms you experience are the nerve root compression, where there will be pain in legs and also foot and thighs. Once you neglect at this stage, there will be serious complications. There can be pressure on your spinal cord, and in the next stage, you have severe problems like lack of erections, lack of bowel movement, lack of coordination in the legs, and all the symptoms that are related to myelopathy, where there is pressure and compression on the spinal cord. If you don't take care of this at the early stages, surgery is the only option for you.
Fidicus Homeopathy.